video as well from the TTA Help Desk. And you can also download these handouts too from GoToWebinar. If you look at your GoToWebinar control box, there's a box that says handouts. This file can actually be downloaded from that box. And you can also participate in the chat or pose any questions under the question category. And I also activated the attendee list, so you can see who's also on the call with us. Again, thanks so much for joining us. This is one of those, it's somewhat of a different type of webinar that we want to try to do a better job and make a conscious effort, especially for new providers who are coming in, staff persons that is, and our LME colleagues and so forth, to make sure that we do a better job of talking about and expanding upon the mission and goals of the TTA Center, and some of the items we want to accomplish and the next year. And we've also included and built out, and we'll be building out some different technologies that we hope will make things easier for providers to participate in training, and also technologies that we can share with providers as well, as much as we can on a statewide level, since technology in and of itself is somewhat expensive. And one of our goals and hopes and dreams is to be a resource statewide for providers. Again, thank you for joining us. We have with us in Winston-Salem, Alex Elms and John, and Stacy is calling in from Illinois, one of our new staff persons, and we'll let everybody introduce ourselves in just a few minutes. Just a tad bit of background. Many of you have been part of the prevention system since the inception and transition to the TTA process. And some of you may be nearer to the field, but there's certainly a focus on strengthening and making improvements and providing evidence-based practice and research-based practice within the field of prevention, and how we can ensure high quality delivery of prevention practices in our local communities, those practices that are culturally relevant and evidence-based, and address statewide priority and needs. That's one of our missions as part of the TTA Center, is to help community members be responsive, or community providers to be responsive to the needs of their communities within a evidence-based framework. And centralized training system was created several years ago, and we are primarily funded by state block grant funds, the same funding that your substance abuse block grant prevention efforts are funded by. We've been through many transitions as the TTA Center, but our primary goal has really remained the same: to help build evidence-based practices and processes within our local communities, and also to help build and retain a high-quality workforce that possesses the skills necessary on the prevention side to implement those evidence-based prevention practices, but also on the workforce development side in terms of building professional skills that are relevant, needed, and skills that the field is interested in developing through daily practice. And this is a really interesting model, being able to provide at no cost to providers and communities at large, training opportunities statewide and within our regions related to effective prevention practice. Many of you know I live in Virginia, and the prevention system is much more dispersed, and there's really no one centralized training system for providers out there. So this is a wonderful opportunity and resource for providers out there. And as part of my research the past 10 months or so is looking at other states who have attempted to do this and did this well. And if anyone is interested, California has a very interesting and efficient and statewide training prevention system that has some age to it. It's been around for a long, long time. And so there's evidence-based models out there that can guide us in delivering high quality training opportunities. And I just saw a quote back in 2014 that we've used in another documentation from Pamela Hyde, who was serving as the SAMHSA administrator at that time. And this belief that creating a system of support and knowledge within prevention professionals, within prevention workforce, and disseminating that knowledge to the workforce at large and to the communities will improve our outcomes and improve satisfaction within the workforce of those individuals who work within prevention communities. And to me, that's a really powerful quote and philosophy and statement, that if we can help the workforce increase its level of capacity and its passion towards the work of prevention on a daily basis, then that will in turn increase the effectiveness that we all have systematically as providers statewide. So if you were to boil all that down to the nuts and bolts, why the TTA Center exists is we want to develop tools and strategies to improve the quality of substance abuse prevention activities statewide, be a source of technical assistance for those evidence-based practices, to help disseminate those practices in communities. I'm a old treatment person, and what we learned in treatment research many years ago, that's well established, is that it takes about 8 years of evidence-based practice research on the federal level to percolate down to the community level. And we all know 8 years is a long time. I often say, in my educational experiences in the past, 1 day in the community equals about 2 weeks in a governmental setting or a campus setting. And that tends to be true, because we all happen to be so busy and driven by community needs that time goes by really fast. And we need access to the most recent and most relevant and effective information to help us do our jobs better that we can. So we want to decrease that time and space as much as we can from that research base to the actual implementation base, because we realize there's a lag time in between. And improving the understanding of prevention science is certainly a goal. Those of us who are on staff here within the program, we really believe in the goals and dreams and hopes and vision of prevention at large, and I want to share that passion with you. And looking at data, how can we use data to most effectively build our programs and evaluate levels of success? So when folks ask me what I do day in and day out, that's generally the elevator speech for our program. We also have a 5th bullet point that happens day in and day out, but is not always well publicized, is we frequently implement special projects, statewide special projects for the state office. For example, you may have attended faith-based opportunities, a faith-based training last spring. We implemented that activity for a statewide audience. We're implementing faith-based opportunities again at 2 different locations. One location in Clay County, another one in Winston-Salem next month, or in December, that is. And sometimes we focus on youth summit activities and basically one-time opportunities that have become a priority on the state system-wide level, and we implement those projects on a one-time basis. We also, in between those goals and elevator speech items I mentioned before, and the special projects, we want to really be a resource in the implementation of evidence-based practices and promising practices in your communities, and be that research arm of sorts and training arm, of course. And we do that via a variety of options and opportunities we will discuss as we go along, but that being face-to-face and webinars, and building an online training system, which is one of our long-term goals, and we will provide an update in terms of how we're progressing with that independent learning process. Also, one of our focus areas and a primary focus area is how can we build a level of interest and support to be that resource for individuals who are considering registering for the substance abuse prevention credential, and those of you who are already registered with low cost and free continuing education efforts to support your continuing education requirements. Again, there's really four of us at this point. There's me, Jamie. I'm in the left-hand corner. That was this summer, and Alex and John's with me in the office here. They can say hello.
Hello.
That was Alex saying hello.
Hello, everyone.
And I'm sure they are all virtually saying hello again. Most of you have probably met Stacy, well, John and Alex for sure, and you may have met Stacy due to YPE, Youth Prevention Education Efforts and Communication Campaign Efforts, where she was a contractor, where Stacy has joined us part-time to help with content delivery and training. So Stacy's actually calling in, and I asked her to say hello too.
Good morning, everybody.
So again, if anyone's brave out there and want to say hello, you can. But thank you so much, Stacy. So kind of sometimes it helps to provide a name with a face, that type of effort. So again, we're always we love to talk with folks. Sometimes we do business via email, but video is great, audio is great, telephone. We're making a goal for this year to visit half of the prevention providers statewide, and we want to visit the other half next year, in the next financial year. So I believe I have 13 agencies I have to visit. We have to visit this year, and we've visited some of those agencies already, and we have a long list in front of us before June. So we may be reaching out to some of you and asking if we can come out and say hello, and basically a listening tour of sorts. So we're looking forward to that. And again, we all have the same naming convention for our emails. Those of you who have interacted with the TTA Center in the past may have remembered an old email address. Those old email addresses still work, and they forward to the new ncpreventiontta.org address. So we do want to try to transition folks to this new address that matches the internet site for the program. If you ever do email us and don't receive a response within 24 hours, please don't think that we're ignoring you. Just send that email again, especially if it was sent to the old address. Although those emails are forwarded through a natural course of policy, technology is always imperfect sometimes, and are always imperfect or perfect based on your perception. So just reach out to us again. We've spent the past 9 to 10 months attempting to look at some of the technology we were using and if it was working, and how we can make some improvements. And those of you may have seen some of these changes, and many of these changes are not apparent yet, but we've actually created a online help desk that if you were able to attend the LME meetings, many of you may have saw and have been referred to based on common questions and issues. So we're trying to collect a body of knowledge that we can share with the field based on our past technical assistance request, based on best practices in terms of research, based on supporting material and manuals and videos we are creating for the state. And even this webinar, for example, and the slides will be entered and inserted into the help desk process, which is searchable. So I really want to share with folks this growing resource that we're probably using to 20% of its capacity right now, but is going to become a centerpiece of what we do, a resource for the state as well. We've also created a archive of webinars, even going back to the CPR days, the Center for Prevention Resources, that was hosted in our old webinar system. Those of you may remember that we used WebEx historically within the state for training purposes. Well, this spring we tested out and transitioned to the system we're using now, which is GoToWebinar. And the question was, and one of our goals was not to lose all that content that was created before us. So we downloaded the content, and it's publicly available for anyone that was created over the span of the past 5 years or so. I want to share with folks how to access that, and it's also located within the help desk. And technical assistance request. Generally, 95% of the technical assistance requests we receive is via email or telephone, but we do have an online tracking system as well. You could submit a technical assistance request online, and it's a trouble ticketing process that helps us track TA requests and ensures completion and so forth. We have not fully developed this to its fullest extent. This is why we haven't marketed this online TA request process yet, but it is active, and if anyone wants to test it out, feel free. Common question that we receive really frequently, at least once a week, is how to create a new ECHO account or how to reset a password. And again, I want to use that example as a way to share the help desk process with you. And we have created, most of you have seen the new training calendar that's been out and online since, I believe it was March, April, when we activated it. So it is a interactive and live training calendar that we're beginning to tweak and make heavy use of to avoid sending back and forth digital files and so forth. So you will always see the most recent training calendar entries. This is actually a screenshot of the help desk, and I'm going to flip over to the live view in just a moment. But one of our major goals, again, is to build a library of knowledge that can be accessible anytime, day or night, and can be that first line of defense for resources you need. That doesn't mean that we want to encourage to stay, not to contact us personally. We always want to encourage folks to contact via email or telephone, but this is just another resource. And currently, I'm displaying the ncpreventiontta.org website. As a sidebar, the website's undergoing a redesign to be somewhat more streamlined and to serve information to state providers in a much more easier and clearly defined way. We hope to have the pages launched around Christmas for testing, and Many of the resources you see here will remain the same. We will have similar buttons in terms of help desk and training portal and really big buttons for signing into Echo and so forth. But the page itself will just be much more streamlined and have a different design. But so I've mentioned the help desk multiple times, which will really encouraging folks to take to benefit from. So you may see this help desk button. Not sure if you've noticed it before. And the help desk button and training portal button and echo button is also available via mobile devices. So you should see these buttons if you log in via phone or tablet or so forth. If you click on the help desk button, you will see a page that looks like this. And I say, this is our help desk. This is what I mean. Currently, the help desk is divided up into 5 categories: a general TA category and FAQ, meaning just generic questions that prevention providers tend to ask over a period of time that we thought would be extremely beneficial to share. We have NCTTA training files and resources. This is a master category or library of past training resources, documents, videos, PowerPoint slides. We have created a sign board. Since sign our work and will be of great importance statewide, there's a specific Q&A information and material specific to sign that we want to archive and make sure. Master grid, a really important foundational document of their daily activities and work. This includes how to download the master grid, how to use it. In this, last but not least, which is our biggest category, is Echo. And simply put, it's a category of everything that supports Echo. And I'll just spend just a few minutes providing some examples. If we look at the General Technical Assistance folder or section, this is really our smallest section so far. We have 2 categories or 2 subsections. How to use NCTTA online resources. If you click on the article, the connection bills too. Hello, can you still hear me? Okay, can you still hear me? Hopefully everybody can still hear me. We're having a small connection issue there. So Yeah. Okay. Again, there seems to be a bigger issue with the audio internet connection for some reason. Let's see, Misty, your hand is raised. Let's see. Feel free to unmute if you can hear me. Hopefully, you can hear me. Again, I'm showing the help desk introduction, and this is a sample document that could be downloaded that shares how to use the help desk. Here's a really neat article that is common acronyms in prevention, prevention profession, and Ashley Murdoch. And she helped compile a acronym list of sorts related to common acronyms used within the health and human services setting that was applicable in the treatment, specifically for treatment and prevention. So this is a really good resource, especially for new providers. And special credit to Ashley for providing this document. Again, if you have general technical assistance questions or FAQ answers questions you would like to have entered and included for statewide inclusion, please send those to us. We would love to have the field help us build out this section of the help desk. Another category is materials for the current financial year in terms of training materials and videos, and past years. We have two categories, materials and supporting documents for 2017-18 and for 2018-19. So for example, I have already created an article for this current webinar. If you click on the article, you see the description of the article for this webinar, and you see the opportunity to download the slides from today's article, from today's webinar as well. So this is already out here. Once our recorded video is processed, I will also embed the video that can be watched within the help desk here. Also, in the second column, you will see the materials from past training years. And there are 13 articles, and usually each article has a PowerPoint presentation or additional supplemental documentation you can access. Plus, we have a link for past webinars and videos that is really an archive of the past webinars we could post, and webinars going back several years back in time. And if you were to click on the video archive, we've actually created a YouTube channel that supports current and past videos. So we can take a look at all the videos. And again, some of these videos do go back in time, and we want to create a historical record and save as many of those training materials that was created many, many years ago to this point forward, and have a living, breathing archive for current webinars such as today within the system. Okay. We have a category for SINAR to support activity within SINAR. Many of you may have participated in the SINAR webinar that was held September 25th. If you did not have a chance related to ECHO merchant tracking data entry, the materials and the webinar can be viewed within the help desk. We also have guidance related to SINAR protocols related to media and public relations, law enforcement, community education, and merchant ed for inclusion and consideration. Plus, we've included some information related to FTA, tobacco information. How do you report a product violation? And what is FDA product violations? And what some of the criteria sets. So this could be really, really good information for staff who are conducting SINAR outreach and tracking activities. Master grid. I know we've talked about the master grid so many times over and over and over. But the master grid is always available. That's the most recent version within the help desk. For example, the most current version is August 2018. So the master grid can be downloaded from this page. We also have provided PowerPoint slides that were used during the LME and prevention managers, leaders meetings that we held statewide in August. So as we hold those managers and LME meetings statewide, we usually have one meeting per LME. We will continue to build this category out. And many times we have been asked, of course, and as part of the state process, providers can request a new intervention to be considered for master grid inclusion. And we have a resource here that basically shares how to do that, how to request a new intervention. The link that must be completed to request that new intervention. And we also request programs to email us when that submission form is complete, so we can continue the conversation. Generally, what happens in that case is we help providers collect all of the information in the research base. Then we forward that package to the state office, and if additional research is needed, to Wake Forest for additional documentation. So that is the master grid category. Again, last but not least is ECHO. We have several sections within the ECHO category. Counting reach, you can download and learn how to use the population-based strategy reach tool. Also keep in mind, I think 2 days ago, we published a webinar for November 14th, I think it is, or thereabout, that will spend time talking about how to use the reach tool in coordination with census data. It's a really important topic that will impact our environmental strategy efforts. That if you did not attend the LME provider meetings or have not learned about the population-based strategy reach tool, it'll be a really good resource. We have also created a ECHO manual. If you attended those LME meetings for managers, everybody received a manual during those meetings. Well, we've updated the manual. There's a October 28th edition that if you don't have in your hands, feel free to download. Basically, the changes were the deletion of some parts of the profile setup screens and updating the screens, reporting screens, and so forth. We hope to keep the manual as updated as we can as we go along. Plus, the manual is also 100% online. So we have a document, which is the published manual that can be downloaded and printed. But we have the entire manual is online based on articles. And the neat feature about the online manual is within many of these sections, you have access to videos. For the paper manual, of course, we could not videos. So there's a video that comes up in a few moments that describes how to set up a new user account. So not only do you have the text and photos, graphics within the printed manual, but you also have a video that walks the user step by step through the process. Our video library for this usage It's somewhat small in nature, but we do want to build out as we go along and as the ECHO manual stabilizes and we have fewer changes. So if you haven't had a chance to look at the ECHO manual, please do so. There's a few features of the not mentioned. And the database will search itself for the answer you're seeking, especially if you're seeking something for an answer within the ECHO manual. You can basically just type in what you're looking for, and the system will try to answer you. Since the complete ECHO manual is in the system within the help desk, it's 100% searchable. So if you don't know where to find something in the ECHO manual, this is the quickest way to make that happen. And last but not least, on each page, you will see a help area button. If you can't find answers anywhere else, you can type in how you can help or how we can help you. If the system cannot help you with the material loaded, it will ask if you want to talk with us, and the system will automatically send us a help desk request, which is a neat feature. You will also see a promoted articles section here, which is the most common articles that users tend to access. Thus far, we usually have around 80 hits per week, 80 individual hits per week so far. So we're really happy about that, considering that we haven't promoted the help desk as much as we need to thus far. We do have around 80 people per week who are accessing it at least one time. We've talked about the YouTube channel, our historical archive of webinars. We've talked about that you can submit a help desk request through the help desk website if you so choose. But again, this is not to discourage individual emails or telephone calls. We want to encourage you to most certainly do that any and all times, please. This is only a secondary or third communication channel. Again, I would be remiss not to mention how to create a new ECHO account. That information is within the help desk. But you can also, if you have staff members who need to create a new account, the best way to do so is to click on ECHO. And this is really the easiest way to access ECHO as well from the TTA from the TTA website. Click on ECHO, sign in. Oops. And when the login screen comes up, simply click on create an account, and you will be asked for your name, email address, agency, association, and LME. So as soon as you do that, we also ask all individuals who create accounts or submit a account creation request to email us at the TTA Center and let us know you've did that so we can track that on your behalf and make sure it's completed as soon as possible. Moving on down the agenda topics. I mentioned before, we do have what was new training calendar and registration process for face-to-face events and webinar events. And basically how to access the training calendar, although it's somewhat counterintuitive right now, but will be corrected in the new website design, is folks need to click on Training Center, and that will bring up the training calendar. Okay, in the training calendar, You have three views: a pinboard view, which is the view that we're currently looking at, an agenda view, which lists all of the training opportunities listed in a vertical format, and a monthly view. I prefer the agenda view just for today's purposes. And we have published for this current financial year probably 60%, 50 to 60% of our offerings so far. And we'll continue publishing offerings as the details are confirmed and finalized. Hopefully this is an easier way to locate specific trainings you might be interested in and the information held there or then. So for example, let's click on Dover Youth for Youth. And one of our goals is to provide much better program descriptions of the trainings we are offering, objectives for each of the trainings, locations and accommodations, the attended audience, and the skill level. And if the person simply wants to register, the easiest way is to click the green registration button, and you will be transported to the registration process for that particular and respective training opportunity. Again, we hope this is a better process than the old paper calendar process that was moving back and forth. And if you have suggestions for improvements, please let us know. One of the neat things about the calendar entry part here is you can email the event details to yourself or someone else. You could copy the link and send the link to another person, colleague. You can save the calendar entry to your calendar or even share via social media. So again, it's a more modern approach. If you ever have questions or have registration issues with registering for our trainings, please let us know, and we will be happy to help correct any bugs you may run into. These are some examples of future-facing trainings, face-to-face trainings we have planned. Wanting to draw your attention to SAPS, for example, that's being offered in November at Montreat Conference Center out in Black Mountain, which is east of Asheville, a tad maybe 15 minutes from Asheville. One of our hopes is to better serve the western part of the state. We will be offering SAPS in Raleigh in the spring. We will also be offering youth prevention education training, again, in the spring, in May, where we just offered my PE training, John and Stacy did in Hickory. So we want to try to be more responsive to the large geographic region we serve and try to be more geographically representative as we can be. Our next major training is November 1st and 2nd here in Winston-Salem, implementing environmental strategies and project management. The description is on the training calendar. If you haven't signed up and would like to, we still have spaces. We have 2 spots open, John says. He's just whispered in my ear. So we're really excited about this training. Day 1 will be a large, high-level view of environmental practices, and day 2, using 40 years of research about project management, what we can learn from project management processes and research to better implement environmental strategies. We're looking at 2 really good days. Jane Clark is the trainer for the first day, then I'm taking care of the second day. Again, we're using GoToMeeting and GoToWebinar as the backbone of our training infrastructure and online meeting infrastructure, moving away from WebEx. Generally, it works without any issues at all. Today must be one of those days that it's not going to appropriately for audio purposes. Hopefully that has settled down. But one of the neat issues about these 2 systems is they have really, really good mobile device apps. And the GoToWebinar app for the mobile phone and the tablet is just excellent. You can participate at the same level on the go in a field-based setting as you can setting at a PC. It's an excellent app. If the app's installed on your phone and you're logged in, once you click one of our registration links, the system automatically registers you for that event without you having to do anything else. It will remember you. So it's a really good application on the go. And the same is true for the GoToMeeting app. The differences between the two systems is we use GoToWebinar for trainings that require registration. Then we use GoToMeeting for on-the-fly trainings or on-the-fly conversations, such as technical assistance calls, cures calls, those type of things. If you ever have any issues with GoToMeeting or GoToWebinar, or as an audience member, you have issues or want to make sure your system works in advance, just let us know. We will create a test instance and help you learn the system. And again, these systems are open to your use as well. Based on scheduling, we can only run one instance at a time, but we can host up to 500 people at one time. So if you have a special event or need to host an online meeting or session that requires registration, let us know. We'll be happy to help you. We'll run the technology in the background and help facilitate the session technology-wise for you and your content experts to take care of. Again, some future-facing webinars that are listed on the training calendar. The Master Grid is an upcoming webinar. Basically, this will be a basics of how to use the Master Grid to set up appropriate profile creation within Echo. In all the data we're looking at within Echo, the most common issue in terms of data consistency and reliability is how we set up Part A and Part B. Because how we set up Part A and Part B sets the stage for every single screen that comes afterwards. And so many parts of Part B within Echo is based on the Master Grid. It all flows like a river or a pyramid. If you can imagine Echo being the basic foundation, well, the Master Grid being the foundation, then Echo is setting on top of the foundation. So we want to make sure that especially new providers and new professionals in the field have an understanding of the Master Grid and the importance of using the grid in coordination with Echo. And we also included a screenshot of HIV/AIDS, for example, that's being offered January 30th and 31st. We already have 80-ish people who have signed up. Al Bishop will be providing that. It'll count towards your certification credit requirements. And we have a ethics webinar as well scheduled for later in the spring. Jane Clark and I will be doing. We have a military focused webinar that's not published yet. And a webinar focused on vaping and use of tobacco products, all to support certification credit requirements. So be on the lookout for those. We're trying to build the online training system, which is a pretty heavy lift to build it from scratch. When we are ready to release the content, we hope to focus on 3 content areas for this year: drug trends and updates, basically drug updates. And this will be modules that can be completed 100% self-paced. You can log in and complete the 1 to 2 hour experience, take a quiz, watch some videos, download some material, then gain certification credit for that experience. We hope to have at least 7 substances, drug updates posted by the end of the financial year that could be completed. We want to focus on the addictive process, understanding the cycle of addiction from a prevention perspective and human services perspective is another priority, and prevention 101. What is prevention? Especially what is prevention through the public health lens, and what is substance abuse prevention? So we can provide a better framework for individuals who may not be part of our daily activities and conversations. and better explain what we do day in and day out. Again, in terms of technical assistance, we certainly attempt to focus on ECHO technical assistance. So if you have issues with ECHO, questions, data that's not appearing as it should be, you're not sure where to turn, we're really your first line of defense. We can help with conducting research for those new strategy implementations, requests prior to being received by the state office. We're looking at customized training opportunities. If you have a customized training need within your agency, let us know. We might have resources to help you support that training need and be able to provide something specialized for your staff and your agents in your community through a variety of partnerships that might meet a need. This is one of those opportunities that I'm really excited about, is being able to provide those one-time opportunities based on agency need. That could be for 5 people or 50 people or somewhere in between. And technology assistance, audio, video. We're slowly building a social media studio that supports video and audio production here in Winston-Salem. A lot of that equipment is mobile. We can't produce 4K TV quality video, but we can provide extremely high quality video and production assistance for the social media setting. So if you have those needs and interests, we certainly can provide some guidance and technology assistance there. A couple of items that we have not announced, but certainly start thinking about it. We will be conducting what I want to call focus groups or user support sessions related to ECHO this winter. We will be providing 4 of these sessions in Hickory, Asheville, Fayetteville, and Rocky Mount. And the goals of these is to basically listen to your user experiences within ECHO. What suggestions do you have for improvements? I would actually like to watch many of you who are willing to bring your ECHO accounts with you and watch you use ECHO and your normal use process. And I think when we have conversations like that, there's so many suggestions for improvements and suggestions of how ECHO can work better in the grand scheme that each and every one of you may have thought about as users day in and day out, that we want to start collecting those suggestions, those ideas for improvement, and those problem areas of ECHO where it just seems a little bit too clunky. Or could you do this instead of that? It would decrease the amount of time and data that we have to enter. We basically want to have a listening tour. This is one of those optional listening tours where we listen to feedback from the users to make the product better and to be more responsive to community-based need. So we're scheduling these 4 face-to-face sessions throughout the state. And the sessions are not necessarily divided up by LME region. They're more or less divided up by geographic region. So your agency may exist in the Via LME, but you can't make it to the January 29th Asheville session. You're free to come to Hickory, or those of you who may be on the East Coast, it may be more convenient for some reason to come to Asheville, hypothetically, if you want to see the mountains or so forth. So we try to disperse these sessions, about 2.5 hour sessions statewide to be geographically representative based on location and not LMEs. And additional information will be presented and published about these sessions as soon as we finalize the actual meeting locations in terms of the conference room, that type of thing. But we want to encourage heavy users of ECHO to come in and share your experiences with us. Help us make the system better. Help us track problem areas and how we can improve the interface. That's really, really important to those of us in the TA system and at the state level too, is to create a ECHO process that's useful, meaningful, and easy to use. let's see. It is now 11:59, and that was really my attempt at a 60-minute elevator spiel for the TTA Center. And we're really glad that you joined us. We would like to open things up to questions or comments if anyone has anything that you would like to share. Hopefully the audio cleared up on our end. We do apologize. We believe it was an internet connection based on research from our end, an actual connection issue, a not issue with the system, thankfully. We certainly appreciate all the support that you have provided the training system and your attendance in webinars such as this and training events. We will be conducting a survey of sorts in the spring, asking what types of customized training and workforce development, professional development opportunities you might be interested in participating in within the prevention concept, but also outside of the prevention concept as well in the field. How can we help you be a more confident professional in the field? That's one of our inquiring questions. But again, we certainly appreciate your attendance and your participation. We will stay online and see if we can have some Q&A or respond to questions in the meantime. And feel free to unmute yourself if you want to say hello. We would love to hear from you. Other than that, thanks so much for joining us.